Hi, Tim Russell here for Inovera Bioscience and Forvia Vitamins and Forbones XtraD calcium tablets. So calcium, who needs it? Sure, that's what bones are made of, but once a person's fully grown, why would you still need it? Well, it turns out your bones don't stay the same all your life, or even all day. Instead, individual bone cells are constantly being torn down and new bone cells created and added to the skeleton. So what happens to the calcium from the bone cells that were torn down? Doesn't that calcium go right back into the new bone cells? Not that simple. First, your body has other uses for calcium than forming new bone. Calcium's main function, besides forming bone, is to power your muscles. Calcium ions trigger muscle contraction. When you think about how many times a day your heart muscle contracts, you can see having calcium available is pretty important, even when you're just sitting. Well, your body's pretty clever. It maintains a circulating level of calcium in your blood so that calcium's always available to the muscle cells and for other purposes. And your body keeps a convenient calcium bank handy called the skeleton. So it can withdraw stored calcium from the skeleton to keep the circulating amount in your blood at the proper level whenever the body needs more. Of course, all day long we all lose calcium, primarily through urination, but also sweat, fecal material, any cells we lose along the way, like from the lining of our intestinal tract. So humans need to take in additional calcium to replace what's lost. If not, bones gradually lose calcium and become less strong. That's called osteoporosis. Most people in the U.S. get their calcium from dairy foods, especially milk, because milk's high in calcium. There are some things that can get in the way of getting enough calcium from diet. For one, some people are lactose intolerant and can't eat foods containing lactose, like milk, without stomach distress and diarrhea. Another thing, as we get older, our bodies become less efficient at absorbing calcium from foods, especially from age 65 on. Besides age, there are other things that can reduce people's ability to get enough calcium from food. Surgeries of the intestinal tract, especially gastric bypass surgery, reduces the amount of intestinal cells available to absorb calcium from diet. Diseases of the intestinal tract, like Crohn's, have the same effect, since inflamed or scarred sections of the intestine can't do their normal job of absorption. Now, the recommended daily amount of calcium for most people is 1,000 milligrams and 1,200 when you're over 65. That's the equivalent of 3 to 4 8-ounce glasses of milk. For people with Crohn's and some other intestinal conditions, daily requirements may be more, and recommendations for post-gastric bypass are 2,000 milligrams a day. Fortunately, calcium supplements are available so people can take in extra calcium, be sure they're getting enough, and without eating vast amounts of kale. In another video, I'll discuss what kinds of calcium there are in supplements and which is best. So thanks for watching.